Are you finding that you're almost never interested in being intimate with your partner? Do you catch yourself steering clear of moments where you might be alone together, worried it could lead to sex? Well, I'm Dr. Rena, and today we're going to talk about low libido, also known as a low sex drive. If you're new here, we cover topics like urologic health, bladder awareness, sexual wellness, and so much more. I know many of you watching are men, and I truly appreciate you being part of this community. I encourage you to share this video with your wives, partners, or friends so they can better understand their own libido and recognize when it might be helpful to seek guidance. This video begins a new series where I'll be discussing women's sexual health alongside men's health. So if you're male, please stay with me, learn something valuable, and pass it along to the women in your life. In this video, I'll focus on the causes of low libido in women, and in the next one, we'll explore what can be done about it. But first, what exactly is low libido, and how is it defined? The medical term is hypoactive sexual desire disorder, or HSDD. It's clinically described as a reduced interest in sexual activity, which may include not responding to spontaneous desire, meaning a lack of reaction to sexual thoughts or fantasies, or not feeling motivated even when your partner provides romantic or physical cues. It can also involve little to no desire to initiate or engage in sexual activity at all. Often, women experiencing this may avoid situations that could lead to intimacy, or only participate out of worry about their relationship. Another key factor is that this represents a change from your usual self. It's not something you've always experienced, but something that has developed over time and lasted for at least 3 months. Most importantly, it becomes a concern when it causes meaningful distress, such as tension in your relationship or personal frustration. For some people, though, having a low level of interest doesn't create any problems for them or their partner, and in those cases, that's perfectly okay. I also want to make it very clear that this is not the same as mismatched desire. Mismatched desire simply means that your partner wants sex more or less often than you do. That is a completely separate issue and does not automatically mean you have low libido. So, how common is low libido? If you look at survey research, about 40% of women report experiencing it at some point. However, only around 10 to 12% feel truly distressed by it, and those are the individuals we're focusing on here. If it does bother you, it can have a real impact. It may lower your confidence, affect your sense of self-worth, and reduce overall self-esteem. It tends to be more common in people who are in committed relationships, and studies show that in longer-term relationships, these concerns can become more noticeable over time. As relationships continue over the years, both sexual activity and satisfaction often decrease. It's also important to understand that women with low libido frequently experience other sexual health concerns, such as difficulty with arousal, trouble reaching orgasm, vaginal dryness, or even pain during intercourse. These issues may contribute to low libido or be closely connected to it, so addressing them can sometimes improve desire as well. Before we go further, it helps to understand how the brain responds during arousal, because this explains why certain factors influence libido. When you feel aroused, specific areas of the brain become active. These are known as sexual excitation pathways. They rely on chemical messengers called neurotransmitters, with dopamine playing a major role in promoting desire. On the other hand, there are sexual inhibition pathways, which become active when you're not interested in sex, or after intimacy during what's called the refractory period. These pathways typically involve neurotransmitters like serotonin, and sometimes substances similar to opioids. So when considering what may lead to low libido, several factors come into play. Medications or medical conditions that lower dopamine levels, increase serotonin, or raise opioid activity in the brain can reduce sexual excitement. In contrast, anything that boosts dopamine or lowers serotonin levels may increase sexual desire or reduce those inhibitory signals. If you look at individuals with HSDD, or hypoactive sexual desire disorder, they often have a tendency toward increased activity in the brain's inhibitory pathways, or they may develop changes that reduce excitation or heighten inhibition. In one study, researchers compared women with and without HSDD by having them watch erotic videos while monitoring their brain activity. The scans showed clear differences between the two groups. So if you're dealing with HSDD, it's important to understand that this is not something you're choosing or causing. There are real differences in brain chemistry and activation behind it. As I mentioned earlier, many women with low libido also experience other forms of sexual dysfunction. So the risk factors we're about to discuss are not limited only to low libido. They can also contribute to other related concerns that affect desire. Causes of low libido may include psychological conditions like depression and anxiety, relationship challenges with a partner, as well as fatigue and ongoing stress. Certain medical conditions and medications can also play a role, and physical issues that make intimacy uncomfortable or painful may further reduce interest in sex. When it comes to psychological factors, yes, it may sound unusual to say, but emotional health has a powerful connection to sexual desire. One major issue many women face is a negative body image, such as feeling unattractive or unhappy with their appearance, and working through these concerns can sometimes help improve libido. Pregnancy and childbirth can also bring significant stress, exhaustion, body changes, and hormonal shifts, all of which can affect sexual desire. In fact, a study of 400 first-time mothers found that 3 months after giving birth, regardless of whether it was vaginal delivery or a C-section, about 83% reported difficulties with sexual activity. Even at 6 months postpartum, around 64% were still experiencing some level of sexual concern. This shows just how common these experiences are. You are certainly not alone if you're going through this. Additionally, simply raising children or dealing with infertility challenges has also been linked to lower libido. Looking at medications, several commonly prescribed drugs for mental health conditions can contribute as well, especially selective serotonin reuptake inhibitors, or SSRIs, which are widely used to treat depression and are known to sometimes reduce sexual desire. So if you're taking one of these medications and noticing a drop in your libido, it's a good idea to speak with your psychiatrist and ask whether adjustments can be made. Some antipsychotic medications, as well as anxiety medications known as benzodiazepines, may also contribute to sexual dysfunction or reduced desire. Another topic I find especially interesting is oral contraceptives. The research is still unclear on whether birth control pills directly cause low libido, but I can tell you this comes up very often. Many people report changes in their desire after starting hormonal contraception. If you feel that applies to you, consider discussing alternative options with your gynecologist. In fact, we're currently conducting a study reviewing what people share on Reddit about low libido, and oral contraceptives are frequently mentioned. I'll be sure to share those findings once they're published if you'd like to learn more. Now, when it comes to medical conditions, several have been associated with low libido. One example is diabetes mellitus, which may affect nerve function throughout the body and lead to reduced sensation, including in the genital area. Similar effects can be seen in neurological conditions like multiple sclerosis, Parkinson's disease, and seizure disorders such as epilepsy. Low libido has also been observed in individuals with chronic kidney disease, requiring dialysis, as well as in those with high blood pressure, either due to the condition itself or medications like beta blockers. People living with chronic pain conditions may also experience reduced desire, which is understandable, as ongoing discomfort can make intimacy less appealing. Additionally, individuals who have recently been diagnosed with cancer or have completed treatment may also notice changes in libido. These factors are quite understandable when you consider how they affect overall well-being. When it comes to physical causes that make intimacy uncomfortable or painful, several conditions can play a role. Issues like pelvic floor dysfunction or having overly tight pelvic muscles can lead to discomfort. Conditions such as pelvic organ prolapse or leakage of urine or stool, known as urinary or fecal incontinence, can understandably make intimacy feel less appealing. Chronic pelvic pain can also reduce interest in sex. For women who are postmenopausal, a condition called genitourinary syndrome of menopause, caused by reduced estrogen, can lead to thinning and less flexible vaginal tissue, often resulting in pain during intercourse. I'll be creating a separate video on this topic, so if you're interested, please let me know so I can prioritize it. Lastly, certain gynecological conditions, such as fibroids or endometriosis, can cause pain during deeper penetration, which may also contribute to low libido. I hope you found this information helpful. Be sure to stay tuned for the next video, where we'll talk about treatment options for low libido. And as always, take good care of yourself, because you truly deserve it.